Hi, Abby here with nursing.com. In this lesson, we'll discuss fibrinogen. Of course, we're going to talk about the clotting cascade. We'll talk about normal values, increased values, decreased values, and why we would draw this lab. Let's get started. Fibrin degradation products, abbreviated FDP, measures for the amount of these products in the blood. And what are these products? They're actually a result of fibrinolysis. Fibrinolysis is the process in the body when a clot is broken down. That's a normal process. When this clot gets broken down, there are products that are released like D-dimer and other substances. Those are FDPs. It evaluates for clotting disorders. Clinical indications are for signs and symptoms of DIC. What is DIC? Remember all that crazy overproduction or overformation rather of clots? And then there's no more fibrin, right? That is DIC. It also helps to evaluate the function of fibrinolysis in the system. Is it working correctly? And to evaluate if there's a clotting disorder. Now, why did I include this picture of the uterine side of the placenta? Well, if you were to really be able to see and look at all of this, you would see all of these teeny tiny little capillaries and also the bigger arterioles, venules, and all of that blood networking and how exposed it is on this uterine side of the placenta. So what's left in the uterus is also this raw edge of all of these vessels. And so in DIC, if it becomes this hypercoagulable state, like can happen with placental abruption or even in postpartum hemorrhage, we're going to draw this lab to see, is the clot breaking down properly? Some normal therapeutic values are less than 5 micrograms per milliliter. And collection happens in a light blue tube because we're looking at coags. The lab value will be increased for these fibrin degradation products in the case of disseminated intravascular coagulation, DIC. It's also going to be increased if there's clotting disorders, meaning that there are so many clots that there's so much more of those products as a product of fibrinolysis. We will see this in liver disease, kidney disease, and congenital heart disease, increased values. And even during pregnancy, this can be the case in preeclampsia, placental abruption, like we talked about, and even miscarriage. They'll also be increased in transfusion, right? Transfusion, there can be sometimes that inflammatory process. And inflammation, we're going to see clotting, and in clotting, we're going to see fibrinolysis. So then we're going to see an increase in those products, right? Now, it can also be apparent in cases of bypass surgery. There's so much hemolysis and fibrin and clotting and breakdown in bypass surgery. So there's going to be products left over as a result. And then in transfusion or transplant rejection. Now, low incident of the fibrin degradation products are not clinically significant or related to any disease or disorder process. FDP, or the measurement of fibrin degradation products, are what are produced in the breakdown process of blood clots, and it measures or evaluates for clotting disorders. Normal values are below 5 micrograms per milliliter. There is likely always some clot formation and fibrinolysis going on throughout the body all the time. So for there to be just a little bit at all times is normal. We want that. It will be increased with disseminated intravascular coagulation during blood clot degradation and in clotting disorders or liver disease. A decreased value is not clinically significant. Now, you've all done great on this lesson, and this wraps it up on fibrin degradation products. Remember, we know you can do it, and we love you. Now go out, be your best self today, and as always, happy nursing.